Yes, Samriti, yes.
Okay. So, good evening, everyone. We are going to do a workshop on handling social anxiety and improving social skills by Silent Door. So, my name is Anubhuti, and with my co-facilitator Mansi, we are going to facilitate this workshop. So, Mansi is going to give you a short introduction on what is social anxiety, its symptoms and causes. So, Mansi, you can take over.
Yes, thank you, Anubhuti. So we're talking about today is the topic is handling social anxiety and improving social skills. So let me start by introducing what social anxiety is exactly. Social anxiety is a mental health condition characterized by an intense, persistent fear of being judged, negatively evaluated, or humiliated in social situations. So people who have social anxiety, they generally escape social situations. They fear that the people will only eventually end up judging themselves in a negative picture rather than seeing both the sides of the situation. So, fear of social situations, individuals with social anxiety, they often fear social interactions, such as meeting new people, public speaking, or even eating in public. So, we have noticed that there are a lot of people who do not engage in public speaking because of their social anxiety. They feel that what others will think when they are giving public speeches. They lack the ability to actually, deliver what they know sometimes because of their anxiety. Avoidance behavior, like I said, to cope up with their anxiety, individuals might avoid social situations altogether, which can interfere with their daily lives. So sometimes the social anxiety is at a normal pace level, such that they are avoiding public speaking, they are avoiding uh, interacting with individuals. But sometimes this avoidance behaviors becomes so much that it interferes with their daily lives, their relationships, and their work, such that the people actually uh, end up isolating themselves. People end up, not interacting with individuals at all. Physical symptoms of anxiety are also there. So when someone is interacting with people, when someone is giving a public speech, they would have these physical symptoms of anxiety, such as rapid heartbeat, sweating, trembling, nausea, or dizziness, especially in the social settings. Coming on to the cognitive symptoms, individuals may have very negative thoughts about themselves. They fear embarrassment or feel excessively self-conscious. So, in the cognitive symptoms, the people would actually judge themselves and engage so much in the self-critical behaviors. So, self-critical behaviors cognitively could look like, for an example, I won't be able to do this public meeting. I won't, so like if I am presenting today, if I would like be socially anxious, I would be saying that I won't be able to give my presentation today. I won't be able to, you know, uh, deliver it in a way that should be delivered, or would be experiencing some physical symptoms at that time. They actually self-demean themselves. They engage in behaviors that are self-critical for their selves in relation to others because they feel that they would somehow eventually end up embarrassing themselves in a round of people in front of people. So causes, there are different causes of social anxiety. First is a genetic cause or a biological cause. Family history needs to be present for a genetic factor to be present in social anxiety. So predisposition to social anxiety can run in families, suggesting a genetic component. So for an example, if a person who has a family history of their parents having anxiety disorder, any type of anxiety disorders, they could be vulnerable of this social anxiety as well. They could be at a higher risk of this. So siblings, parents, or any relatives in a maternal side or a paternal side, they could be relatively at a higher risk and they would be more vulnerable. Hereditability. Studies indicate that genetics contribute to approx 30 to 40% of the risk for developing a social anxiety. Temperament also. So, one thing that we are very much sure of in understanding the biological factors is to understand the person's temperament. So, temperament is basically what level of shyness or what level of behavioral inhibition individuals have. So behavioral inhibitions are like what they are, what their temperament is. So for an example, if I give an example in this criteria is that, you see that there are some kids, there are some children who are actually very social at the start, from the starting itself. They'll be interacting with others in the room, they'll be talking to others. But at the same point, we see there are some kids who keep on crying, who keep on lingering to their parents. They do not talk much. So their temperament may be different. If someone's temperament, like if children's temperament is like very social, they are more likely to interact with people. But some children who show temperament, whose temperament is of more on the basis of shyness, they would be more vulnerable to have this social anxiety. Brain structure is equally very responsible in this. So first, part of the brain, that is amygdala overactivity. The amygdala, a brain region involved in processing the emotions and also the fear responses, they tend to be very hyperactive in individuals with social anxiety. So when they are hyperactive, their brain cells are actually continuously signaling them to think more and consider the social situation as a threat altogether. So maybe the social situation is not that as much of a level of a threat that individuals tend to explain it. So that's why this overactivity actually ends up having then social anxiety. Neurotransmitter imbalances also, so that we know that anxiety neurotransmitter imbalances are involved, such as when people lack in their serotonin and dopamine levels, they experience anxiety and also mental health disorders, different mental health disorders like depression as well. So this is something that also would be a cause of social anxiety, which regulate their moods and anxiety. Environmental factors, of course, we all are so much embedded. We are social beings, so environmental factors would not be something that would not be looked at this. Negative social experiences. So having past experiences of bullying, teasing, ragging sometimes, it can lead up the individual to think that, yeah, the social world is that way only. So I would be humiliated, I would be bullied, I would be teased if I present myself in a certain way. So this eventually ends up having social anxiety to them. Parental influences. So there are different types of parenting styles that are also kind of impacting the environmental factors of a person. Overly critical, controlling, or perfectionist parents, they may contribute to the development of social anxiety by fostering a fear of making mistakes or being judged. So if in a like for an example, in a person's environment, the family is very critical of not letting them make mistakes. So when the parents do not let their children make mistakes, they'll be like, the world is too perfect. The world is too judgy for them. The world would not actually accept them if they make mistakes. So they end up being they having this perfectionist idea in themselves and having the social anxiety or the fear of being judged. Traumatic experiences, specific traumatic experiences like public humiliation or failure in a significant social situation can also trigger this social anxiety. Cultural factors are also involved. So while we see the collectivist cultures, they actually promote a lot of social gatherings, a lot of social get-togethers. While it could not be the published cause or researched cause. It is something that actually affects an individual in what culture and what society they are uh, like they are born in. So these experiences and norms or expectations that are set can heighten the fear of social judgment and rejection. Especially in the collectivistic cultures, the fear of social judgment is more because, like I said, that this collectivistic culture gives us a lot of opportunities of having social gatherings, socially, you need to be compassionate, you need to be coordinating with people, you need to be good in eyes of others in our collectivistic cultures, rather than compared to the individualistic cultures of US and other countries. Peer relationships, difficulty in forming friendships or being excluded from the peers, when you're not seeking the social pressure or the peer pressure, you are actually not seeking for anyone's validation at that time. At that time, it can also lead to social anxiety when you're having difficulty in forming friendships, when you're being excluded from the social groups. It can lead to the feelings of isolation. Signs and symptoms of social anxiety. Like I said, intense fear of social situations. Fear of negative evaluation is there. So I'll be negatively judged. I'll be not accepted by peers. I'll be not accepted by teachers. I'll not be able to give this presentation right. These could be some of the examples that the person would be negatively evaluating themselves. So, avoidance of social situations, like I said, avoiding the social situations, public speaking, social gatherings altogether, or even also the slightest everyday interactions, making a simple call. So, such people end up avoiding calls, even work calls they avoid, even only the friends catch up calls, they start avoiding all these things. Reluctance to participate, hesitating to participate in conversations, initiate the social contact from themselves is also there. Physical symptoms, like I talked, sweating, trembling or shaking of hands, voice or body shaking, visibly because of the nervousness. Shortness of breath, difficulty breathing or feeling like one can't catch up their breath. Nausea and negative thought pattern, which is a cognitive symptom. Thoughts like, I'll embarrass myself or I'll be rejected. These are some of the examples. I want Anubhuti to take over for this part now.
Okay, thank you, Mansi, for that introduction. So before jumping to the worksheets part, I just want to share a short case with you of a client that, like my internship supervisor shared this case with me of a client who has social anxiety. So let's assume this client name as A. He is 26-year old and he is a finance professional. Now he lives with his parents, elder brother, and a sister-in-law. So he came with a presenting problem of severe social anxiety symptoms, struggles to make eye contact, experiencing panic attacks, heart palpitations, and find social interactions distressing. So these are some of the symptoms of the client. And his anxiety began around 5 years ago. And it has affected his daily life and work performance as well, which leads him to avoid social gatherings and limiting his social support network. Now he described himself as an introvert and he was really shy during his childhood, and he used to have online classes in his school years, so which further restricted his social exposure. So he has faced multiple academic and career setbacks, including an unsatisfactory post job experience. He got fired from there, which lowered his morale and contributed to negative self talk and avoidance behavior. Now this client came for therapy to address his social anxiety. Also, I he has a passion for meditation, yoga, and volunteering. So we get to know like in the sessions of that for that. So now we are going to see how we can use these worksheets for the clients who has anxiety, or even to self-evaluate that whether we have anxiety symptoms or not. So here they are. We have given two checklists. First is like anxiety symptoms checklist. They have given all the symptoms of anxiety. For example, my heart beats really fast, or my skin feels warm and hot. I have thoughts of things going wrong. So you can just tick mark whatever symptoms you think you have or your client have, and then we can evaluate on the basis of that. Then the second worksheet talks about the anxiety triggers. So what triggers anxiety? So for example, in this client A case, whenever he used to like go in social situations or in crowd, that used to trigger his anxiety. So they have given other anxiety triggers as well, like being in a large crowd of people, having to comfort or approach someone, or having too much to get done, maybe a conflict or a drama in your family or your friendship, that also can trigger anxiety. And there are a lot of triggers that they have given, so you can just take a screenshot of it for your reference. Next slide, Mansi. Yeah. So the third worksheet basically talks about exploring social anxiety. So they have asked you which social situations are you anxious about. So they have, like for example, making eye contact in our client's case, or maybe going on a date, being the center of attention. For example, when you are presenting, this can be a social anxiety. This can also trigger social anxieties for few people. Then they have asked, what are you worried about during social situations? Like, what are the consequences you think about that gives you fear? For example, you think you look stupid, or my physical appearance, or you feel like you will being rejected by the people you are there with. And they have also asked to list 3 ways in which social anxiety has impacted your life. For example, did anxiety affect your choice of career, or has it affect your relationship? So you can just write that in 3 points. And then the last question is like a miracle question that they have tried to ask. Imagine you wake up tomorrow and your social anxiety is gone. So how would your life be different? So you can just it helps you to like set some goals for it, like when social anxiety is gone, how your life will look like. And the fourth worksheet talks about like you just have to write where did you feel these emotions in your body. Like you can just draw how you feel it, you can give it words, or draw how your anxiety looks like. And when is a time where you have felt scared, nervous, or worried. So you can just use these worksheets to basically check whether you have social anxiety or client has social anxiety, and how that anxiety looks like for your client or you, right? Then Mansi is going to talk about some interventions techniques, and then I'm going to talk about some of the coping worksheets that we can use further.
Thank you, Anubhuti, for letting us know about the worksheets that can help with social anxiety. Let me talk about intervention strategies here. So there are a lot of different types of therapeutic approaches that are used with the clients who have social anxiety disorder. First one is cognitive behavioral therapy. So CBT basically talks about that how our thoughts, emotions, and feelings, they are all together, thoughts, emotions, or feelings and behavior. Sorry, all three of these are connected with each other. So they use the cognitive behavioral therapy for this. Cognitive restructuring, which means to help individuals to identify and challenge the negative thought patterns. So once a negative thought pattern, once a irrational thought is discovered, now the thing is to restructure the cognition and then work on it to improve and replace them with more realistic thoughts. Exposure therapy, it's a behavioral therapy thing. Exposure therapy means basically gradually facing situations that are least anxious and then moving forward to the most anxiety provoking situations. For example, a person says that I do not feel like to interact with someone who's not my friend. Okay, so first we'll just start the situation by regulating from the least anxious thought, and then going forward to with the most anxious. So the task that a therapist would give to this person would look like, now you have to smile at two strangers in within 2 days or within one day. Now you just have to smile at stranger. This is least anxiety provoking for them, and then gradually increasing the task for them to learn replacing all these behaviors. Behavioral experiments can also work, encouraging the client to test out the beliefs, like thinking everyone will judge them in real world settings. So now, if everyone is judging me, what would happen? What could happen to actually applying these, which often shows that feared outcomes are very unlikely to happen. To apply these situations in real life and then thinking what would happen, doing with the behavioral experiments. Second one is mindfulness and acceptance-based therapies. Mindfulness is basically an act that is encouraging individuals to be present at a present moment. So, mindfulness-based stress reduction, it teaches the individuals to focus on the present moment. So, for mindfulness, for an example, we can practice mindfulness meditation, mindfulness eating, mindfulness breathing. So, in these activities, the client is basically taught to how to be in the present moment. Whenever they are eating mindfully, they need to be focusing on what they are eating, how they are feeling when they are eating, what are the nutrients present in the food that they are eating. For mindfulness breathing, they take deep breaths. And when they are taking deep breaths, they are in the present moment more, and not their thoughts are not scattering all over the directions of past or future. Acceptance and commitment therapy. Acceptance and commitment therapy is basically a type of therapy that indicates the individuals to follow their core values and align with those core values. It helps the people to accept the anxious thought. First of all, you need to be settled with your unsettling emotions at that time. You need to accept that, yeah, I am feeling this feeling. Now I want to change this feeling. So I need to accept to this feeling and then commit to the feelings and then move towards the change. Clients focus on acting according to their core values, right? Like I said, rather than being controlled by their anxiety. So anxiety is a separate entity. You need to, like differentiate that you are not anxious person. Anxiety is something that you have in social situations. It doesn't define you. So there's a short video that I would like to show.
Mansi, I think it's not audible.
It's not audible.
No, no, it's not audible. We can just
Okay.
see your
Um,
screen.
I,
So you
I'll
just
just,
copy paste the link.
I'll just share the link of,
Yeah.
I'll just share the link in the chat box. I've shared the link of the video. You guys can watch this video later on with the audio itself. I'm sorry for this, that I don't know why my audio is not working here. Now, talking about the social skills training also. Role playing is Role playing, it involves practicing the social scenarios. So now the therapist becomes like some person that they, or any situation, social situation that they are in. So they start a conversation, making a small talk, and the client has to react in those situations as if thinking that this is the real world, this is the real practice that is happening, and this is the situation and how that they would react in this. It would help to build confidence and also reduce the anxiety. Communication techniques are also there. Teaching assertively and non-verbal communication skills. So many social skills and communication techniques can be taught to the clients that would make them feel more confident and less fearful of these situations. Feedback and positive reinforcement. So when the client starts doing the activities, starts doing the behavioral activities, exposure activities, positive reinforcement can be given to them. Positive reinforcement is basically giving a positive feedback to the client or constructive feedback to the client, or just like you can enjoy a meal, uh, go out, enjoy a meal at your home when you are doing this in a social situation, or when you are engaging yourself, interacting yourself. So you could be given, so the client could be given a positive reinforcement in such situations. Gradual desensitization and systematic desensitization. Hierarchy of fear. So basically, when I said that the clients, they create a list of social situations that cause the anxiety, that cause the least anxiety. So when, for example, a client says that I feel least anxious when I just have to answer a call. So this is least anxious for me. And the most anxious is when I have to do public speaking. So they'll just list all the items gradually in a hierarchy of fear. This is something that I want to show as well. So this is the ladder that we can practice. Journalize social anxiety, and these are the kind of fears and avoidance that our client has written. So give these are the situations that are presented to the client, and they have to for their ladder they have to present the situations that are least anxious, and then go about naming the situations that are most anxious for them. So give 1 hour lecture to 200 strangers. This is the most anxious that they feel like. So this is something that they do. Introducing yourself at a big meeting, asking questions at a large meeting, asking someone out on a going on a date, to start a conversation with a stranger, being introduced to new people, going to a party, talking on the phone with a stranger, sending back the food, making eye contact, this simple one, eating and drinking in front of others, walking around the mall or another crowded locations. So walking around the mall or another crowded location is the least anxious for this person. And the most anxious is what like giving 1 hour lecture to 200 people. So like I said, public speaking. This is something that they can, use the ladder, the hierarchy of fear, and systematically they would be desensitized towards these situations. Controlled exposure. Clients face the feared social situations in a controlled setting, gradually building the resilience and decreasing the avoidance behaviors. Relaxation techniques are also there for treating the social anxiety. Deep breathing exercises. It helps to maintain the physiological symptoms of anxiety, mainly such as the rapid heartbeat, promoting calmness before going to social situations. So when the clients learn the relaxation techniques, they can manage and they can, be present in the social situations in a way that they would not experience those physiological symptoms with the help of these relaxation techniques. PMRT, progressive muscle relaxation technique. Progressive muscle relaxation technique is basically a technique that starts from the lower part of the body and then gradually moves to the upper part of the body, relaxing all of the muscles in our body, and where we can also feel that where we feel the most tense. So the idea behind PMRT is that you cannot feel anxious and relaxed at the same time. So it kind of is called as in it's the thing is reciprocal inhibition, which is like they cannot feel two things at the same time. You cannot feel anxious and relaxed at the same time. So progressive muscle relaxation helps you feel relaxed at that time. And you can practice this, and with practice, clients get help and they are more good at these strategies. So these techniques actually help them to deal with the social situations whenever they are present out there. Deep breathing exercises, PMRT, this is shown. So PMRT is mostly recommended to person, like clients have to lay down and then practicing from right foot, right leg, buttocks, hands, their arms, stomach, their chest, their mouth, eyes, forehead, neck, and shoulders. All of this progressively helps them to relax. Now I want Anubhuti to take over.
Okay, thank you, Mansi. So these are two of the coping worksheets that we can use on us if we have if you think you have social anxiety or on our clients. So basically, this talks about what social situations made me feel anxious. So as you here we can write just tick mark or circle these situations that make us feel anxious, and then what thoughts do I have when I am in social situations. You can also like color the emoji. How do you feel when there's like any social situations you come around, and what can I do to what can I do to start coping with my social anxiety. You can just write those things. Then the second worksheet just talks about some things that make me feel anxious, and these changes happen when I then you can write some of the changes that you feel happen when you feel anxious, like changes in your body. It's like for example in the client's case it was heart palpitations, sweating. Then thoughts you have, you feel that people will reject you or you feel embarrassed. Then things you can do, so for cope, what things you suggest yourself you can do. Then when I feel anxious I can cope by, then they have given some of the techniques or strategies you can use, like deep breathing, using positive self talk, meditation, or relaxing. Like in the client's A case, he used to do, he was very passionate about meditations and doing some charitable work that used to use that like used to make him feel nice about himself. Then talking to a friend or talking to an adult, playing a game, doing exercises, going for a walk, writing in my journal, practicing mindfulness, or thinking happy thoughts about yourself, right? So these next slide, Mansi. Mansi, yeah. Okay, so these are another two worksheets that I found on how to cope with anxiety. So the third worksheet, anxiety breakdown, basically talks about how you can break down your anxiety. So whenever we experience anxiety, our mind might be like start racing with a lot of thoughts that aren't always true. You feel anxious, and anxious thoughts focus on the worst possible outcome, like the worst consequences. You start to think about worst consequences that can happen with you. So these thoughts can make you believe that things are worse than they actually are, and that you are not capable of coping. So on the left side, they have like you have to write in that cloud few anxious thoughts that you are experiencing, and then try to challenge those thoughts by identifying what is actually true about the situation. That you have to write in the box, like what is actually true, the fact of the situation, and the thoughts in the clouds, right? So this can help you to like set like what are the things that is actually happening, and what are the things that you are actually just thinking in your mind. The last worksheet talks about how I can cope with feelings of disappointed. So some things that make me feel disappointed are, you can write those situations or event. Then these changes happen when I feel disappointed. So whenever you feel stressed, whatever changes happen. This is a similar worksheet that I have shown you earlier also. Changes in my body, thoughts I have, things I do, and then they have again listed out some of the techniques or things you can do. Sorry, for when you feel anxious or stressed in situations, in certain social situations. So these four worksheets you can definitely use whenever you feel anxious, and to like break down thoughts and divide, like separate your thoughts from the actual fact, and your feelings and behavior. So yeah, that's it. Thank you. If you guys have some questions or some insights, some thoughts you want to share with us, you can definitely do that.
Okay, I have a question. Uh, Hello, am I audible?
Yes,
Yes,
ma'am,
yes.
yes.
Yeah. So I just want to. So there is a case I have of a girl, 12, 13-year old, and just 1 year back she got her menses also, and so since childhood she's had a childhood where parents are very busy, not able to give time. Mother is also busy, and and then in the house also she's seen a little bit of a kind of physical violence, or not a very severe one, but there is like the mother used to beat if she was angry, or there is an argument in the house, and then this girl used to uh, see that there is so much of anger, and then it is your mistake. So maybe the mother was angry with all this happening, and then she used to since she was not able to take it out on anyone else, she would hit the child for any mistake what the child would do. So this has been the atmosphere, And then so now she's having this complaint of like, she came because she felt that she is a little abnormal kind, like, she's feeling that she's little different from the others around. And she doesn't want to uh, talk much with friends, or she doesn't have very close friends. She has just, some some classmates in. And so this is her situation. And then she doesn't want to open up to her parents. She says she doesn't trust her parents. Hmm? And so how does she feel about all this is like, what does she do is, so she feels, when she feels sad, she cries. And she doesn't want to cry in front of anyone, but she cries alone at night. And sometimes when it is too much for her to take all this, so she bites herself. So self harm, so she herself used this term self harm, like I try to harm myself, pull my hair, or sometimes I get, if I feel very bad, she doesn't get angry as much as like feeling sad, and she wants to hit the wall, she wants to bang her head to the wall. So in this, like, and then she doesn't like to talk to people, meet people. She doesn't want to now go to school. This is what her present situation is. So, and when she was small, she used to like to go to school because, like, maybe for some time she would avoid the house or the parents, or, that is her state of mind. That was. So now she's not liking to go to school also, so, but she's very good in studies. uh, that is the only one thing which is like somewhat positive in her situation or things. So in this case, like, how would you approach? So is it a kind of social anxiety here, or depression, or you know so how would we approach this child to begin with?
Okay, thank
Ma'am,
you for, yeah,
yeah,
Mansi,
I
if you
would
want.
okay. Ma'am, here I would feel that exploration part is much needed to decipher it as a social anxiety disorder altogether. But like you said, that there could be the factors of that
Hmm.
witnessing. She was witnessing physical abuse, right?
Hmm. Hmm. And she was
Yes.
like, maybe sometimes parents are used to hitting the children, so that kind of thing also has been there in her mother used to beat her. And another thing what she said is like, so I always feel, and she overthinks, she herself said that, I'm overthinking, I'm thinking about all the negative experiences in past, and what else, when I sit to think, like, all these things come to my mind, and then I feel a little anxious also. So that also she said, and I feel guilty, she said. She used the word guilt, like, I feel guilty. I feel it is all my mistake. Like, anything happens in the house or anything goes wrong, it's because of me. I'm at fault. So, so from where the social, whether it is social anxiety she's going into, and this is the source, or how exactly we would approach, like, first, what to deal with, like, and what would be the intervention like in this?
Ma'am, how old is she?
She's 13-year-old.
13
13
years.
year old. Hmm.
So
And
in
maybe
this case,
because last 1 year back, she got her menses also. Since 2, 3 years, she's realizing that there is some problem with her. So, and she never used to open up to anyone for anything. Not even her grandmother. She's not in good terms. Like, she doesn't have any, so doesn't trust parents. So, but this time she felt like she needs help, or that is what. Then she told her parents, like, I need to, see a counselor or someone, and that's how she came. So, and 1 year back, so maybe because of hormonal things also, it must have aggravated. But definitely from childhood, she's been having all this. So, yes, so you can just let me know how to.
None here, I would just be inclined towards using the CBT approach, like I said.
Hmm,
But since I'm a trainee counselor, I do not have much
hmm,
experience to be
hmm,
said. But this is what my understanding of this case looks like. So I would
hmm,
just go with cognitive restructuring because you just mentioned that she has guilt feelings. This is
hmm,
something
hmm,
that is not her control. Her parents beating her and
hmm,
she
hmm,
witnessing the
hmm,
physical violence at the same time is not something that's in her control. So we could use intervention and activities such as locus of control, that what she can control and what she cannot control. And also
mm,
by restructuring all her cognitions, first of all, deciding and also looking towards her cognitive distortions. I would
mm,
like if you could explore more of the cognitive distortions, and also
mm,
because
mm,
of there are past experiences involved, and that is why the social anxiety is reoccurring in the sense that she's
mm,
like
mm,
kind of feeling faulty thinking she's doing, and also worst imagining. These are the like cognitive distortions she's engaging in, that or the worst will happen to her if she's engaging with her peers as well. This is something that I feel like she's doing.
mm, mm. Yeah.
So cognitively restructuring her thoughts would be, and also helping her to engage in the relaxation practices could also help. Rest,
Mm.
Anubhuti, if you would like to take over. Also, Sumati, if you want to speak,
So her
Yeah.
self harm, about her the self harm,
Can I?
anything?
Hello. Hello.
Yes, you're audible.
Yeah. Can I say something?
Yeah, yeah,
See.
sure.
yes,
Yeah.
please.
In this case, I feel that because of the critics and humiliation, abuse, she might be losing her confidence. So we have to work on her self-esteem. One thing, and second, it may be the hormonal tantrums and all these things. Anxiety might be because of that. But that's why she is feeling that guilty and all these things. It's a low self-esteem, whatever she's facing. Along with the hormonal changes, her reactions might be different, and she may be her cognition should. That is one part is correct. That is her cognition should be restructured. But I think first we have to build her self-confidence. Am I okay?
Mm, mm.
Yeah, I think
Yes.
I agree
Yes.
with both Sumati ma'am and Mansi as well. Like we have to work with both cognitive restructuring her thoughts, like what she feels in certain situations, and then working on her self confidence. Also, it sounds like the child is experiencing significant emotional distress stemming
Mm.
from her troubled family dynamics, right? So we need to
Yes.
counsel her, and then parent. I
Parents.
think family and parental counseling can also work with her. Also,
Mm.
we have to obviously refer like immediate safety and support concern like should be there, and apart from that we have to identify her triggers, like what are the triggers that she feels, and in this case I think it was like a trauma response. If the child has experienced physical abuse or has treatment in their childhood, their behaviors may be all the behaviors may be a response to their trauma, and children who experience such environments often feel unsafe sometimes, right? So
Mm.
attachment theory can also be used here, and attachment and trust issues can be there possibly. So we have to work around this area, I think.
Okay. Yeah.
Yeah.
Yeah. Okay. Thank you.
Okay. Any other questions? And thank you, ma'am, for asking that question.
Yeah. Thank you.
So if we don't have any more questions, we can end the meeting here, or we can just 2 minutes if you guys want to think of anything else. Okay, then I think we can end this meeting here. Thank you all for joining us in this workshop. And yeah,
Thank you so much, everyone, for joining us today. Thank
Thank you.
you.
Thank you.
okay, thank you.